out whether Nancy is officially retired or not. Whatever, she can retire in name, but it's going to be in name only. Jack, it's good to see you. And I want to thank the Patient Advocate Foundation for all that you do. Patients are absolutely hopeless when they call us. They call in Congressman's office when they're having trouble with the government. They've already been told no, and they're frustrated. And so when they call you, they're at their wits' end. And you do so much for so many. And it's just such great work. When you talk about medical debt, most of the people in bankruptcy have medical debt. Most of them have insurance. And it's the co-pays and deductibles that get them. Thankfully, the Affordable Care Act did a lot about that. For those with modest incomes, we limit the amount of co-pays and deductibles that you can get hit with, so that you keep insurance affordable. One next step we have in many states, unfortunately, like Virginia, is expanding Medicaid. So we have 400,000 people that could get coverage under Medicaid if the General Assembly would just vote to accept the money. And there's some interesting numbers. 400,000 people would get coverage. The general fund would have an extra $100 million in it. That's because people who go to MCV hospital or UVA hospital or the health department and don't pay, well, they just don't pay. If they can't afford it, they have a Medicaid card. They can pay those bills with federal money. That's more money in the general fund, amounts to $100 million a year in Virginia. 30,000 jobs created. Because the disproportionate share calculation, extra payment isn't being sent out anymore, that's because you shouldn't have any disproportionate share in indigent care, so you don't need the dish payments. University of Virginia Hospital is going to lose $140 million. But they pick up 200 in the next 6 years. In that same period of time, they pick up $280 million with expanded Medicaid. University of Virginia Hospital and MCV, they'll remain. Rural hospitals will go broke and close unless we expand Medicaid. And add insult to injury, 400,000 people will get sick, will go to the hospital and won't pay. And so your policy and everybody's policy will be a little bit higher to cover your health care and everybody else. And so you've got $100 million extra in the general fund, you've got 30,000 jobs, you've got rural hospitals staying open, you've got everybody's insurance going down. And if you don't expand, you'll take $100 million out of the general fund, you essentially lay off 30,000 people could have been working, you're gonna close rural hospitals, you raise everybody's premium in order to deny 400,000 people their coverage. Our job is to make sure they keep repeating this so that people can see how absurd it is not to expand Medicaid. It's 100% the first 3 years. After that, it's 10%. One member of the Senate, Walter Stosh, is a CPA, has figured out that if you take that $100 million every year and bank it and invest it, you can, with the proceeds, have enough to pay the 10% in perpetuity. So he's a CPA, so he figured that out. So we need to make sure that these 400,000 people that will be coming to your doorstep, Nancy, begging for help, make sure they have comprehensive insurance coverage to cover most of their bills. Nancy, I just appreciate your advocacy over the years. As you indicated, we've been doing this a long time. You started with a shoestring, and now you've got a multi-state operation covering a lot of people, and tens of thousands and hundreds of thousands and millions of people calling in every year getting help because of the good work that you do. God bless you for all that you do, and on behalf of all those you've helped, thank you very much.